Hey there, it's Rita at Gold Medical Jobs. Yesterday was a fiasco. I'm so sorry. I've been having internet issues, so I have called my provider, and hopefully that won't happen. But they haven't. We haven't figured it out yet. Oh dear. And so I hope today goes well. Today is the 12th of September. Yesterday was 9/11, and it's a sober day and a somber day, and I was born and raised in New York, so I don't think it matters if you're born and raised in New York, but it affected me terribly because people I know were affected terribly, parents and children and so forth, over 300 deaths. So, and I had friends that just were going to funerals for a month straight or more. So it's a day I can't ignore. It happened 18 years ago. And what I want to say and what I think about when I hear the stories repeated or news stories still, I still hear news stories on Facebook and so forth, and is that we are Americans strengthened by the story of who we are. And people stayed calm. I mean, not everybody could stay calm, but people stayed calm and helped one another. And the bravery and the good fortune we have from the survivors about the bravery is a beautiful thing, is what our democracy is about. And so I don't want to pass by that day without remembering it and appreciating our Americanness, and that we won't live a frightened life, that we need to continue to promote goodness and love over hate. So 9/11. We passed 9/11, and here we are at 9/12, and it's Rita at Gold Medical. And I usually like to share with you an experience, and I began to yesterday, and I'm not sure if it's something I've shared before, but I think it's kind of a cute one, and I'll tell you about it. And then in days to come, I will, I was talking about yesterday that I think I want to broach some different topics, and an interesting topic, an important topic is salaries, RN salaries. So since Gold Medical is all about healthcare employees and healthcare employers, I think it's important to talk about it because things haven't gotten cheaper in a long time. Good grief. I was in a Trader Joe's, and I was just picking up some fruits and vegetables, and it was so expensive. And I'm used to shopping in the farmer's market, or we have a store called Sprouts that has really pretty terrific fresh vegetables. We have just different stores that I shop at, and so I'm not accustomed to $4.99 for a couple of strawberries. And that was things are not getting cheaper. So so our income is important, right? Okay, anyway, so my story was that one of my last clinical positions, I was a clinical manager. That meant I sat at a desk, and I connected with people out in the field, primarily travelers, per diems, more often travelers and per diems, and counsel them on issues they may have been having. And my glasses are so crooked. I can't find my good glasses. So I was at a desk, right? I wasn't in scrubs or a uniform, and I wasn't clinical. But for many, many, many years I was. And even after I became an administrator and an owner and operator of a staffing agency, I had the opportunity to be clinical. And one of those jobs was in interventional radiology and cardiac cath. We did lots of a variety of procedures throughout the body, and the vascular and cardiac and so forth. And so this is kind of, it's sadly funny, but one of the things we did routinely were cardioversions. And we did a cardioversion because somebody probably had a hiccup in their heartbeat. It was too slow, it was too fast. And so as the term sounds, it's we need to revert or reverse or snap that heart out of it and see if by creating that diversion, we get that patient back into, that client back into a good heart rhythm. So, you know, doggy, shh. She sneaks in here and then she stops. Stop it. Stop it. Come here. Come here. Stop. Behave yourself. That's the gardener, and you know them. Anyway, so nurses have different ways of prepping patients. My way is to be pretty frank and to let them know that I'll be by their side, I'll hold their hand if they have any questions and so forth. And I explain that I'm going to sedate them, but it's a conscious sedation, so that if I need them to hold their breath, etc. So there's a lot of preparation involved. Usually when a patient comes in for a procedure, is anywhere from an hour to an hour and a half of prep, and you get an IV going, and you develop a little bit of a relationship. You sense how calm or nervous the patient is, and you know, you talk to their family members and get the post-op situation organized, you know, what they can expect, when they'll be ready, if they're going to be eating, and so forth. So you do a lot of that. And then the procedure occurs. And for these types of procedures, sometimes there will be a respiratory staff member, certainly the doctor, the cardiologist will be present, and myself, the nurse. And so you minimally are going to have 3 people, a nurse, a patient, and a doctor, but oftentimes there'll be other, and it depends on the patient's condition. Are they outpatient? Are they inpatient? Etc. So I'm going to admit something to you. It's kind of silly, but when patients, a lot of times patients want to know that, is it going to hurt? And, you know, I'll use words like sharp or deep or uncomfortable, because with conscious sedation, there isn't a strong memory, and I don't want the focus to be on pain, but I won't deny that there'll be some discomfort and so forth. So cardioversion is kind of like you might see on TV and in the movies, is that we go clear at the moment of cardioversion. We go clear, so nobody's touching a bed rail or whatever, and make sure you're not standing in a puddle of water, whatever. You know, we just say clear, and everybody knows what they're supposed to do, and then the paddles are applied to the patient, and a charge is given. And in cardioversion, we don't use the maximum charge that we might for resuscitation, but we use an amp of maybe 100 or 150, whatever the doctor's ordering. And the power of that, and the patient is sort of in this sedate, sleepy place when that occurs, the power of that often makes a patient jerk or literally rise off the bed. And I am here to admit to you that every time that happens, almost every time, that I am conscious of, because I'm conscious of so many things, I'm giving meds and I'm watching monitors, that I gasp. And I honestly, I feel like I feel a little pain in my heart. Can you see me? I feel it. I sense that pain in my heart. And the patient will often, their eyes will pop open. Sometimes they'll scream. I'm right there. And you're okay is the first thing I'll say. You're okay. And often they go right back to sleep because of all the medicine on board. And, you know, when I reflect back on it, I'm like, geez, would you ever get used to it, Rita? And the answer is no. I don't. I don't like to see people in pain. I'm happy when I can do something about that pain. But yeah, cardioversion kind of makes me grin because of the experiences of seeing people, you know, literally lift off their bed, or some of them sit up and go, what? You know, or, you know, so funny things happen when people are consciously sedated. And that's one of them. I thought I'd share it with you. Newer nurses, don't be afraid. You'll know what to do. There's policies and procedures and standards and, you know, your meds. You become to know your meds. I'm always myself more on the prudent side. You know, always start off with a little less medicine. You can always add it. And I've worked with nurses, and they start off, they have a level they start off. It's usually higher than what I start off at. And I respect them too, because they know what they're doing. They have their own experiences. So yeah, I don't know. That cardioversion, it just makes me gasp. And hopefully not too loud. And I thought I'd share that with you. So today is an odd day for me to be here. It's Thursday. Normally I'm here Monday, Wednesday, and Friday. And Gold Medical is here for you always, round the clock, on LinkedIn, YouTube now, Facebook, and Twitter. Okay, so we're here for you. We are nursing employers, and nurses rock, and healthcare is important, and we want to share with you as much as we can, whether you're, geez, my stupid glasses, whether you are a healthcare employer or a healthcare worker. And we have many, many nurses at Gold Medical. So employers, find the nurse you need. We hope you find the perfect match, and we will do what we can to make that happen. Thanks a lot. I'll see you soon. Bye-bye.